Good morning, everyone, to the EULAR TV. I am Mohammed Shipa, one of the academic rheumatologists from University College London, and I'm delighted to present you our upcoming session at EULAR 2023 about the future perspective of SLE and Sjören syndrome, and we are delighted to be joined by Professor Joan Merrill from USA, and she will be presenting her phase 2 clinical trial in SLE, where they have compared low-dose JAK inhibitor versus JAK inhibitor and tyrosine kinase inhibitor combination therapy in SLE. Good morning, everyone, to the EULAR TV. I am Mohammed Shipa from University College London, and today we are delighted to be joined by Professor Joan Merrill from University of Oklahoma.
Hi.
We are delighted to have your presentation about the phase 2 clinical trial in SLE. Would you like to talk about that more?
Yes, I would. For decades, we've been having trouble getting any interpretable data from lupus clinical trials, and that's because the disease is so heterogeneous.
Absolutely.
And it's very hard to get an outcome when all the patients are not like each other and they may not be responding to the same drugs. We've made some advances in recent years, and you've probably heard that there have been a number of phase 2 trials that have been quite successful, and including one phase 3 set of trials that's been quite successful. And that's because of two things that are being done differently. One is that we're trying to pay attention to tapering of steroids so that we can get rid of some of the background noise in these trials. And the other simply is to pay very close attention to the quality of the data and have monitoring by people who are very experienced in the field and in taking care of lupus patients. And it seems to be giving us lower placebo response rates. Now we can see whether a drug works or not.
Fantastic. And it's been the same story about difficulties in lupus trial as usual, recruitment of the patient and the measuring the
Recruitment of
outcome.
patients is getting more difficult these days because there are a lot of companies developing treatments for lupus. So there are only so many trained trial sites out there.
Yeah, absolutely.
But that also affects the quality of the data because we're trying to find these good sites and we're fighting over them.
Yeah, absolutely. Looking forward to phase 3.
I am very much hoping that there will be a phase 3 trial of this drug. As you know, it was a study of upadacitinib, which is a JAK inhibitor, alone at 30 milligrams, with or without elsubrutinib, which is a Bruton's tyrosine kinase inhibitor. And both formulations showed efficacy in the primary endpoint. The primary endpoint was the SRI-4, which is commonly used, but in addition, there had to be steroid doses as low as 10 milligrams or less to meet the endpoint. And they met that with a nice low placebo response rate, and then met a number of secondary endpoints, including the SRI-4 at 48 weeks, and the BICLA, and the lupus low disease activity state, as well as showed differences in flares and time to flares. So very wonderful data. And we were able to obtain it because we got the placebo response rate down.
Right, great, thank you. That's really great. And last but not the least, has it been a poster year for SLE, you think?
I think it's been a landmark 3 years.
Okay, all right, perfect. Thank you so much for joining us. Thank you, everyone, for joining us at the EULAR TV. Thank you.
Thank you.